I'm the hormone specialist, pharmacist Lane Kilpatrick, and this is you, Chief Medical Officer. Welcome to the podcast. Hello, welcome to the podcast. I'm your host, pharmacist Lane Kilpatrick, and it is my distinct privilege to have on the show today Dr. William Harris. Dr. Harris has been a leading researcher in the omega-3 fatty acid field for more than 40 years. In fact, I would argue no living person has been studying omega-3s longer than Dr. Bill Harris. He has more than 400 scientific papers on fatty acids and health, the vast majority on omega-3. He's been on the faculty of 3 medical schools, and in the face of high competition and rigorous review, he's received 5 NIH grants to study omega-3s. He was the co-author on 3 American Heart Association statements on fatty acids and heart health. And as the co-inventor of the omega-3 index blood test and founder of Omega Quant Analytics, who makes that test, Dr. Harris has been ranked among the top 2% of all scientists worldwide by Stanford University based on his influence and the impact of his research on society. Impressive. In the field of nutrition, we learn a lot about the importance of what a given nutrient does in the body, but we often lack good objective endpoints that we can measure to determine its optimization status, or even sufficiency for that matter, that go beyond its simple circulating presence in the blood. Take magnesium, for example. 60% of the magnesium in your body is in your bones. 27% is in your muscles. Less than 1% of it's in your blood, so it's hard to measure. One of Dr. Harris's biggest contributions to science, in my view, was his co-development of what is called the omega-3 index test. It measures the percentage of omega-3s of the total fatty acids in the membrane of the red blood cell. With that test, we had, for the first time, a stable, accurate measure of omega-3s in your body that correlates as a risk factor for heart disease, just like obesity and blood pressure. It's extremely valuable to know if you're getting enough omega-3s in your diet or in the supplement that you're taking if it's a good quality. If it is, it'll raise that omega-3 index score. That metric can't be fooled. So this test is a big deal, and Dr. Harris and I share the belief that it should be part of the annual exam lab panel for every patient. Omega-3s are that important. So, in today's episode, I asked Dr. Harris the most popular questions you submitted, and he'll answer those. Thank you for that input. I appreciate it. With that, I give you, without exaggeration, a giant in the omega-3 world, some even affectionately call the Codfather, the distinguished Dr. Bill Harris. Dr. Harris, what a pleasure to have you on this podcast. I appreciate your accepting this invitation today.
Happy to do it.
Great. I'm just going to kind of jump right in here. I wanted to have a talk a little bit about the basics of fatty acids. Maybe if you could just explain so that people understand what they are, why they're important, what they do in a general sense.
Yeah, in a general sense. Okay, great. And again, thanks for the invitation to talk with you and your folks. Fatty acids are, I guess, one of the 3 kinds of nutrients that we eat. We eat proteins, we eat carbohydrates, we eat fats, and fats are almost completely fatty acids. So when you think about butter, you think about vegetable oil, bottle, that's fatty acids. There are different forms, but those are fatty acids. And fatty acids come in 3 general flavors. We call saturated fatty acids, which are hard, like think butter, Crisco, tallow.
Solid at room temperature.
Solid fat, right, at room temperature, right. And then we have the monounsaturates, think olive oil, think canola. That's richer and they're now liquid at room temperature. And then we have the polyunsaturated fatty acids that are definitely liquid at room temperature, corn oil, safflower oil, sunflower oil, and those are the big categories.
Okay, so what's our main function in the body? Where do we need these the most?
We need them for many of those fatty acids, not the omega-3s. The omega-3s are a subset of the polyunsaturated fatty acids, of which there's 2 families, omega-6 and omega-3. And both of those, the polyunsaturates, are not typically used for energy, for burning, for calories, whereas the mono and the saturates are used for energy and storage. The polyunsaturates are used to help build membranes around cells, and they're used also they're converted in the body by certain enzymes at certain times into very active molecules that turn on inflammatory systems, turn off inflammatory systems, have a lot of functions in that regard. But so they're metabolically active. The polyunsaturates are kind of metabolically active. The saturates and monounsaturates are usually more for just energy.
Okay, but having said that, they're considered, the omega-3s and omega-6s for that matter, are considered essential, meaning we can't make them, so we've got to get them in the diet, right? Even though they're not a food source of energy.
Right. They're essential for non-energy purposes.
Okay. All right. Well, in my pharmacy practice, I always tell people if there's one supplement that you should take, make it omega-3, an omega-3 fish oil.
Attaboy. Good man.
Omega-3s are, they almost have this mystical, universal force for good in the body. And I don't even know that we fully understand it all yet. But you said you believe that's largely due to its impact on inflammation, and some of the inflammatory resolving effects as well. And I'd like you to address it before we do that. I'd like you to address the effects on platelets too, because first, can you break down the inflammatory benefit a little bit, and then I don't think most people understand the resolving side of inflammation.
Sure. Okay, before we get to platelets and what they do there.
Yeah.
Right. I think most people understand that when you have a cut, you need you get a bacteria or a bug gets in your blood or something. You need an inflammatory response. The body is designed to respond to invaders with a inflammatory response, an immune response. They're kind of mixed together. And that's a very complicated web network of this molecule turning on that molecule, which eventually produces a protection against these invaders. And that inflammatory process is natural and normal and expected, and we need it. When it doesn't resolve, I mean, now you're getting into the resolvins. I know. Normally that, if you've got enough omega-3s in your body, then that inflammatory response, which will kind of make it look like it's going up, the omega-3s, if they're there, will cause it to go back down after time. If you haven't got the omega-3s, it tends to stay active. You have a kind of a chronic inflammatory response going on, even though you've already dealt with the primary problem. There's a little bit, it's like the smoke that's left over after you have an inflammatory insult. And the omega-3s simply are a group of molecules that can be called into action to shut down an inflammatory response and bring it back to normal.
Okay. So when we have a, shall we say, a non-threatening, maybe judiciously applied stress, in other words, there's a hormetic response, meaning it actually has an adaptive effect that is supportive, right? And that, but when we have this for a long time and it's chronic, then that's where we get this maladaptive situation where there's damage from inflammation. Is that right?
Yeah, that's a good way to say it. Right.
Okay. So so for a finite period of time, it's going to serve a purpose of protecting your body from that pathogen, invader, whatever it is, and then it should go back down. So some of the things that we deal with now, I think maybe more than our ancestor did. I don't know. Maybe they had bigger problems than we do.
Different problems. Right?
Different. Is this sort of low grade, not really threatening stress, but stress nonetheless? And would you say that's the reason that many of us kind of live in this overly inflammatory state?
That's probably true. it's very hard to, look over time and compare us to them, not knowing, of course, they had 100 years ago, we had, like a huge portion of the world's population died of the flu, and would that have not happened, if we had more omega-3 on board? No idea. But we're able to fight that off now. We have a lot more medicines. Although I think humans, as a species, every generation we collect a few more mutations over the year. And I think we're getting, in the really, really long run, getting weaker as a species because these mutations don't get fixed. Everything starts working. And I think if were it not for public health, clean drinking water, clean sanitation, the medical world, obviously drugs, surgeries, all these advances, I think we would be dying sooner than people used to die, because we're just genetically getting weaker, and we need to fight back with nutrition as well as we can. We can't change our genetics.
Right. Yeah.
Anyway, get a little philosophical here, but that's
that's all. It's all good. I'm a big believer in sort of cleaning up our environment. It's sort of insidiously, slowly crept in, and
that too.
Nobody notices it, so to speak.
Right.
So,
right.
So, do omega-6s kind of have a PR problem? I mean, they're essential as well, right?
Yeah.
And so, but we seem to think that they're bad. That seems to be the message everybody takes away from it.
Right.
Can we talk about that for a sec?
Sure. And I think you're absolutely right. They got a PR problem. And the PR problem started 30, 40 years ago. And there was some logic to it in the 1980s. I think in the 2020s, the logic is going away. The idea generally was the omega-6 and omega-3 fatty acids are kind of like cousins. And they can be acted upon by similar enzymes to convert to more active products in the body when the body senses a need for them. And if you haven't got the omega-3s, then the omega-6s is really all you've got. And they make some pro-inflammatory molecules and lead to inflammatory reactions that are not opposed by the omega-3. It's not that the omega-6s are bad, that's just what they do. And people have tried to paint the omega-6s completely as like all of them are bad. And that's just patently not true. The primary omega-6 fatty acid in the diet and in our body is called linoleic acid. It's 18 carbon, 2 double bond omega-6 fatty acid, and it constitutes, say, 50% of like corn oil. A lot of linoleic acid. We eat a lot of linoleic acid. Question is, are we eating too much? Are we eating too little? And one way we've asked that question is we've looked at blood levels of linoleic acid. And everybody's got them. Everybody's got different levels. And when we look at large populations of individuals, we find that people who have the highest levels of omega-6 linoleic acid in their blood actually are lower risk for heart disease, for type 2 diabetes, and for total mortality, death from any cause. The higher the levels of linoleic acid, the better. Now, there's other omega-6 fatty acids like arachidonic acid, which is one of the metabolic products of linoleic acid. It's made into that. That's a little bit more of a mixed bag. Higher levels of arachidonic acid in some studies is not related to any risk. Neutral, not good, not bad, doesn't make any difference. Other studies, higher arachidonic is associated with a bad outcome, with higher risk for some disease. So the omega-6s and they're not one homogeneous group of fatty acids. We have to be more careful in what we talk about. If we want to talk about linoleic acid, I think we are the message that this is bad, the seed oils rich in linoleic acid are bad, is misplaced. I think we need to not be cutting back on linoleic acid in our diets. Now, based on the evidence we've seen, if you lower your blood levels of linoleic acid by eating less, which has to happen since it's an essential fatty acid, we can't make it. If you eat less, you're going to have lower blood levels, and lower blood levels are associated with higher risk for heart disease, diabetes, and total mortality. So that's not good. No, it's not good. And most of the people I talk to who are, dead set against omega-6 at all have no answer to that question. They don't. What do you do with that data? They just kind of ignore it, which is, I think, unfortunate.
Well, there's a lot of them on social media. Yeah, there's just, it seems to be the thing to do, jump on that bandwagon and disrespect seed oils.
Right. Well, and, I'm not talking about seed oils per se, because it's entirely possible that there is something in seed oils that is bad for you. I'm not saying there is or there isn't.
Okay.
But I don't think it's the linoleic acid. That's possible.
Okay.
There may be something else. So it could be true, and unrelated. True seed oils are bad for you. True linoleic acid's good for you, but these are unrelated factors. In any event, the omega-6, omega-3 ratio, I don't know if you were going to get there, but that's kind of where we're at. That has been a metric that I have railed against for years, partly for that reason that some omega-6s are good. And so to compare good with good omega-6, good omega-3 doesn't make any sense. You only want to make ratios out of a good versus a bad. Mm-hmm. That makes sense. But you can't say that all omega-6s are bad. Secondly, there's several things about that ratio, but go ahead.
Well, is there a process that drives that metabolic process and conversion to arachidonic acid, as something that's driving it in a negative way that people should address? Or are you saying just correct the ratio by increasing the omega-3s?
Well, if you're going to use a ratio, omega-6, omega-3, and it's not good, whatever it is, the way to correct it is to eat more omega-3, not to decrease the omega-6. And that's part of the confusion of that ratio thinking is you're led to believe that you can improve that ratio and get healthier if you reduce the omega-6. And I don't believe that.
Okay.
I think if your ratio will be fixed, if you want to fix it, by eating more EPA and DHA.
Okay.
And that's fine.
But you prefer not to look at it as a ratio?
No.
How would you have people view that then, so they get the picture?
Well, if we're talking about blood testing, so people want to know how much omega-6, how much omega-3 in their system. And when we do blood tests, we measure all of those. We think it's important to focus on the EPA and DHA content of your blood, your red blood cells, which is what our test primarily tests. And to make sure that EPA and DHA is up where it needs to be. Don't worry about the linoleic acid, the omega-6. To me, it's not the point. The point is getting the EPA and DHA up.
Okay, then to be clear, we're not having any commentary here on seed oils, but you are saying as omega-6s as an essential fatty acid play a role, and they play a role in bones, brain, reproductive processes. They have
everywhere.
Function. Yeah. Okay.
Oh, yeah.
All right. So don't worry so much about the omega-6 side.
Don't
Increase
worry
the
so
omega-3s.
much. Right. It's very easy. It's much easier just to focus on get the EPA and DHA up.
Okay.
And everything else will sort out.
So people really don't have the need to measure their omega-6?
I don't think so. I mean, honestly, I know it's heretical to say, but we have thought about putting out an omega-6 blood test because we are getting more and more convinced that the levels of omega-6 are important. The levels of linoleic acid are important, and higher levels are chronically associated with better outcomes. And so if we're just going to be completely objective, we would say, well, if you think higher omega-3 is good because it's associated with better clinical outcomes, and the same studies show that higher linoleic acid is good for reducing risk for heart disease, diabetes, etc., then why wouldn't you want to monitor it? Why would you not want to optimize your omega-6 linoleic acid levels? We haven't, at Omega Quant, our company, we haven't actually produced that test yet, partly because of exactly what you're saying, the urban myth, I would call it, that omega-6s are bad is very hard to swim against. I do my best to swim against it, but we might just get a lot more pushback and trouble than it's worth by offering a test like that.
Well, I think this will be surprising to most people when they hear this this sort of upside to omega-6 because of that prevailing sort of myth out there.
Right, and there's a lot to be said about why that myth is wrong. But
okay, and we've got this product, by the way, and we'll talk about that a little bit later. But let me just ask you: Are there any other important omegas? What about 6 or 7s and 9s? Is that something anybody should be really concerned about?
No, I don't think so.
So a supplement that includes all those, you're just probably paying for something you really don't need.
Yeah, right. 6s and 9 omega-6s, we eat plenty of them. We don't need. I mean, maybe one of these days we should supplement, right? But at this point, we eat plenty in our diet. Okay. The omega-9s we can actually make from carbohydrates and proteins. We can synthesize them, so we don't need to eat them. If you're going to take an omega product, then it should be an omega-3, and it should be EPA, DHA. And ALA is not going to give you the benefit. ALA is the plant omega-3, classically from chia seeds or from flaxseed oil, etc.
Okay. Yep. Good. I've tried to make that point too. Let me talk about for a second oxidation, because that's with the polyunsaturated fatty acids. You got a double bond in there, and for those of you that don't have or don't care to have the chemistry behind this, there's a double bond to an oxygen, which is subject to it's a rather reactive kind of situation there when there's oxygen, heat, light, those kind of things that feed that, and that's a problem, right? So can you talk about what happens there? What are the metabolic products of that, and why it's a big concern for people?
Yeah, and certainly in chemistry class, in a test tube, if you put a polyunsaturated fatty acid, so meaning polyunsaturated means many double bonds, and the double bond, as you said, is the place where the oxygen can attack. It's particularly susceptible. And so in that setting, the more double bonds in a molecule, the more unsaturated the fatty acid is, the more oxygen reacts with it, and the more what we call, reactive oxygen species, ROS, are produced. And they're not good. But that's in a test tube.
Okay.
In vivo, in our bodies, number one, we don't have light. That's good. We have oxygen, but we have a whole panoply of systems set up to protect against the production of these reactive oxygen species. And when people have looked at markers of reactive oxygen species, ROS, as a function of omega-3 levels, they're not higher. Just the higher, because you have higher omega-3 doesn't mean you have higher oxidation of fatty acids. Because there again, the body is designed to protect against these things. That doesn't happen in a test tube. So I'm not concerned particularly about. I mean, some would say you need to take more vitamin E when you're taking omega-3 fatty acids to protect them from oxidation. Well, I've not really seen the data to prove that. It's not irrational, and it's certainly not harmful to do it. But I'm not sure that's really true.
Okay, so maybe the issue becomes it's more important between the supplier or the manufacturer of it and your mouth. Once it's in the body, you're saying the systems are there to. That's not an issue. But when that gets oxidized, it's kind of rendered. It can't do what it does as an omega-3, right?
Right. And I guess if we want to talk like chemists, which we both kind of are, We're really talking about what's called peroxidation. When we talk about oxidizing fatty acids, we're talking about producing energy, like you oxidize beta oxidation, right?
And burn fuel,
Perfectly natural, good process. So we sometimes use the word oxidation incorrectly. It's really a oxidation that produces these peroxides. And that's where it attacks across the double bond, and that's bad. But there certainly are situations where eating, even this is kind of crazy. The idea that if you're eating a peroxidized or damaged fish oil, then that's going to harm you.
Okay.
Well, at one level that makes sense. But there's one study that just keeps sticking in my mind, done in Norway to somewhat test this hypothesis. And what they did, they took raw fish oil or edible fish oil, and they put it in a beaker, so exposed to the air. They actually bubbled air through it for a couple of days or something for a long time. So they put a lot of oxygen into it, produced peroxidized fish oil. Then they put it in a capsule, and then they fed it to people for maybe a month compared to non-oxidized fish oils. And they couldn't find any. They looked at, blood levels of oxidized species, of ROS, looked at lipid levels,
the aldehydes and things like that in there?
Yeah, and they couldn't find anything.
No harm.
No, yeah. It was no apparent harm. Maybe they weren't measuring the right things. But at first pass, even this really grossly oxidized, terrible that we would never find on the shelf, really didn't hurt anybody, at least in that period of time. So, sometimes we just make assumptions.
So there's the issue of harm, but I think it's safe to say, though, that you now have much less functioning omega-3 to do what you want it to do in the body. So it's a freshness thing, potency thing, right?
Yeah, right.
Okay.
Right.
Let me throw a few questions at you now, if you don't mind.
Sure.
These are from followers. I solicited from them. By the way, we got hundreds, and this is what we try to distill them down to make this manageable. But so, the question is: can you overdose on omega-3s, and are there any risks associated with high doses, excessively high doses?
Yeah. A year ago, I would have said no. No risks. There has been a kind of uncovering in a few randomized trials lately that there seems to be a quite small but statistically significant increased risk for atrial fibrillation in people taking higher doses of omega-3, like 3 or 4 grams a day. Nobody quite understands this. Why it hasn't been seen in the last 30 years and all of a sudden is being seen is a bit of a puzzle. But it's getting to be kind of a consistent observation. And it's not making a lot of sense. When we look at blood levels of omega-3 and ask, do people who have the highest blood levels of omega-3 develop AFib more than people with low levels, we find no, quite the opposite. It's people who have the high omega-3 are lower risk for developing atrial fibrillation. But there's these supplementation studies that are showing an effect. So that's the only side effect, and it's small. So what's the risk? Actually, in these studies, the risk goes from, say, 3% of people on the placebo, for example, in a multi-year study might develop AFib, and 4% of the people on the fish oil might develop it.
Oh.
Okay. So it's the absolute change in risk is very small. The relative risk is not small. So that's the only thing. Bleeding is not a problem. That's the one thing most people think about. Increased risk for bleeding, clinically significant bleeding is not a problem, even if you're taking other antiplatelet or anticoagulants.
And that's the real clinical concern of AFib.
Well, right. And actually taking omega-3 helps reduce risk for the clots that could come from AFib.
Okay. Right? All right. So let me just explain absolute and relative risk. So absolute risk, if something is, say, 1% likely to happen, and then a study proves that now it's 1.2% likely to happen, we look at that and we go, okay, well, that's not a big number. But relative to from 1, or let's make it easy, 1 and then it went to 2.
Okay, sure.
1 and it went to 2. So then the relative risk is 100% more likely. And that's what scares people. But when you look at it, okay, that was only a shift from 1 to 2. You got to kind of keep this in mind when you're looking at risk and how it changes things.
Oh, I agree completely. And you can be statistically significant and clinically insignificant.
Right? Yes. Statistically significant, which is a statistician's realm, but as to does it change their picture of their health? No. Yeah. So that's an important distinction. This was looked at before, the OPERA study, right? AFib in particular, and I thought that was kind of settled, or it just was that a prospective interventional?
That in the OPERA study, they were trying to one of the settings where AFib often happens is after open heart surgery.
Okay. Mm-hmm.
So the idea was, well, and that's a hassle. It's not necessarily put people at big risk for anything, but it's just a hassle. You got to take warfarin or some kind of blood thinner for a while, and you got to be monitored. So the question was, if you take people who are undergoing open heart surgery and you give them placebo or fish oil before this, so you have omega-3s on board, and then you go through the surgery, and then you look and see who develops atrial fibrillation in the hospital after surgery. And they didn't find any difference. So it didn't increase the risk, but it didn't decrease. They were hoping it would decrease risk for AFib.
So that was a controlled trial?
Yes.
They had, okay, so they had a control group, and well, that should be valuable data.
Well, it's one thing to try to prevent AFib. I mean, this is... and for omega-3s to actually increase risk for AFib. It's very confusing. And most people, experts in this field, are confused about this right now. So it's kind of hard to know what to say about it. Again, when we've published papers looking at in large populations, higher levels of omega-3 in the blood are associated with lower risk of developing AFib. People who take omega-3 supplements in some studies seem to be at higher risk for AFib. But again, it's going from like 3% to 4%. So it's not a huge change clinically, but it's disconcerting.
Would that include people increasing it in their diet?
Probably not. Nobody studied that. I think probably our data based on blood levels of omega-3, which come largely from diet. When we're looking at, 10 or 20 different groups like the Framingham Heart Study, for example. Many people have heard of that. It's an observational what's called a cohort study, observational cohort. You're watching what happens to people over time.
A group of people. Mm-hmm.
The group of people. And we have done a study where we looked at like 15 studies like Framingham all around the world where we know what their omega-3 levels were at the beginning of the study, and then they were followed over usually 10, 15 years. What happens to them over time. And we found that we look at the rate of developing AFib as a function of the blood level of omega-3 at the beginning of the study. We find that people at the highest omega-3 levels are the least likely to develop AFib. So it's contradictory to these give them fish oil supplement studies. So that's what's confusing about it. Science is not always easy. And that's where the data are right now.
Okay, but the more recent thing has apparently given you pause because you said a year or so ago.
Well, you're right, because we didn't know about this a year ago. Then I would have said there are really no side effects, no adverse effects to taking omega-3. And now I have to be honest and say, well, here's something that's popped up that I think we need to talk about.
Okay. Are you referring to is it the one that was in BMJ Medicine here recently?
Yeah.
Right.
Is
that the one you're talking about? Okay. Yeah, because that was, you're right. Not really clinically significant. It didn't seem like, because it changed hazard ratios, but only in those that, those that had high levels?
Healthy. No, it was just that study. I've been doing a lot of work on that study the last 2 days.
Have you?
Yeah.
Well, I raise it because it's been raised by some of my followers.
Oh, totally. Right. I was talking to a statistician just before you and I got together, and we were talking about this question. And in the paper, they don't tell you what the absolute risk difference was between fish oil supplement users and non-fish oil supplement users for developing AFib. And the statistician told me, well, the people that were not on supplements developed AFib over this 10-year follow-up. About 4.2% of them did. And the people that were on omega-3, 4.8%. So it's a 0.6% increased risk, absolute risk for developing AFib if you're on supplement, if you report taking supplements, okay? Again, that's better perspective. I mean, in the paper, they said it's a 13% increased risk. And that's the 13%, 4.8 versus 4.2.
Okay. And I noticed, I mean, they admitted as a limitation of their study that it says here, thirdly, information on dose and formulation of the fish oil supplement was not available in this study. Isn't that kind of important?
Sure, it's important, but they didn't ask it. So they don't have it. So it's just, are you taking supplements or aren't you? And there are many things different between people who take supplements and people who don't,
And if it's based on patient-reported information, that can be...
Yeah, I mean, I think we have to be careful about throwing out the self-report of fish oil supplement use, because there are I think there's 8 other studies. I have a slide on this that I'm getting ready to put together, that have looked at fish oil supplement use in exactly the same group. It's called the UK Biobank.
Mm-hmm.
And they divided the group in who says they take supplements and who don't. And one of the papers reported a 13% lower risk for death amongst supplement users, lower risk for cardiovascular disease, lower risk for developing kidney stones, lower risk for, I'm blanking on some of the other outcomes, but there's several other metabolic outcomes that are all beneficially associated with people who take fish oil supplements in the UK Biobank. So this is the only study that has found anything bad about people who take supplements, and others who have looked at the same data set found exactly the opposite.
Oh boy.
And so that's part of the confusion here.
Okay. Yeah, it seems like this was more about progression of cardiovascular disease, like say from AFib to, or from a healthy status to a stroke, from
right.
Yeah, from AFib to adverse cardiac events, from AFib to myocardial infarction, heart attack,
right.
And from heart failure to death. And that kind of language scares people. I mean,
well, it's the other way to look at what they found is, okay, going from healthy to developing AFib, okay, there's a small increase in risk. But people who have AFib or people who developed AFib are statistically less likely to have heart attacks or strokes or to die. So being an omega-3 supplement user and having AFib is protective. That didn't come out in the paper. It's not clear. There were actually 5 statistically significant favorable relationships with omega-3 supplementation. in that paper, and there was one adverse effect. And the one that got the headlines is the one adverse effect. They ignored the 5 others that were statistically significant. And that's the press. And that's more the press than it is the authors.
Yep. And that's where people wind up feeling a little bit helpless when they're left to interpret the study themselves. This is why it's great to have somebody like you on here to say, here's my takeaway as a whole from that study. Yes, no, needs more information.
Needs more information. Needs to be, yeah. There are other problems with that study, but we don't need to get into them now.
Yeah. All right. What's a recommended daily intake of omega-3s for optimal health benefits? That's a big question.
It's a common question. And I would say if I had to just throw a dart at the board, I'd say about a gram a day.
Okay.
EPA, DHA.
But I know you would also add, but let's see what that does to your omega-1 or omega-3 index.
Yeah, right. Right.
And if it takes you into that protective space.
Yeah, and we published a study looking at, and we pulled together data from 14 different studies that had been done where they measured the effect on the omega-3 index, and they, of course, reported the dose and the duration of the supplement. And we found in that analysis that if you want to go from an omega-3 index of 4%, which is kind of the beginning of the bad, to 8%, which is our target good, it took about 1,400 milligrams of EPA DHA per day in a triglyceride form.
Okay.
If you want to go from 5%, the typical American's around 5% omega-3 index. If you want to go from 5% to 8%, it takes about a gram a day on average. But everybody's different.
Everybody's different. Okay.
Everybody's different. So that's why we advocate testing.
So let's talk about that for a second. The use of testing in omega-3s, I think, is new to a lot of people. But if you think about it, there's all this noise out there about, all these omega-3 products on the shelf are oxidized. They're all rancid.
Yeah.
And so they're not doing you any good. Well, You know what? This settles the question, does it not? If you take and look at the levels in the the red blood cell membrane,
mm-hmm.
and if those are where they ought to be, then your fish oil worked. It was fine. If they're not, and you're taking what the type of dose that should have raised it, then maybe you've got an issue there. But
exactly,
it's really quite hard and expensive to pull a product off the shelf for the average guy and send it off to see how badly is this oxidized.
Well, right. And what do you do with that information? Even to your point, if you're taking that product and your omega-3 index is healthy, it's working.
It's working. Yeah.
Don't get worried. There's plenty of other things in life to worry about.
Okay. How long does it typically take to see results from omega-3 supplementation? I guess that depends on what results you're talking about.
If they're talking about raising your omega-3 index into a healthy zone, it takes about 3 to 4 months.
Okay, 3 to 4 months. And then to translate that across to some of the more important benefits of omega-3, like cardiovascular health, I mean, these things take years to develop.
Right.
So, I mean, it's going to take some time to
right. And
reverse.
That's why, you and I both advocate prevention. You're trying to prevent the development of cardiovascular disease, cognitive loss, Alzheimer's disease, things like that.
Mm-hmm.
Omega-3s are not treatments per se. They're preventive. They're nutrients that we use. If we have optimal levels, we reduce the risk for developing disease. We don't necessarily treat diseases with them.
Well, and that was kind of indicated in this study, too. It was those people that had cardiovascular disease fared more poorly or did not benefit as much. And in fact, those were the ones that they were saying that it maybe isn't good for them to take. Whereas those that did not have cardiovascular disease, they didn't develop. It was protective.
Yeah,
right. Am I right?
Well, sort of. I mean, the way the headlines read, omega-3 can increase your risk for heart disease. And what they've done is they've substituted heart disease for AFib.
Okay.
Because that is the only relationship that was adverse for being a fish oil supplement user was AFib. Everything else was either neutral or beneficial. And heart disease is far, far more than just AFib.
Oh, yeah.
But the headlines were saying heart disease because they have to dumb it down, and they screw it up by doing that.
Is there data out there that shows that development of AFib, say post-surgically, is at all transient, or is that, okay, you've got it, now you need to deal with it, and you're going to continue to have this AFib problem?
No, it's transient.
Oh, okay.
Yeah, but I mean, people develop AFib just by getting older. I mean, the rate of AFib is without surgery,
Mm-hmm.
Yep.
Oh, yeah.
And why it happens, nobody really knows, but everybody knows that the older you get, the greater your risk for developing AFib.
Yep. That's pretty common.
Yeah, I got plenty of friends with it.
Yep, yours truly here. I deal with it.
All right.
Ablation recently is the most wonderful thing.
Good for you. Great.
Yeah, took care of it, but it was, when you say the clinical, like the danger and the threat to your life, maybe is not so much there but it's disruptive. It doesn't feel good having your heart racing and you're sitting there and I can't catch my breath, man. You feel it as soon as it changes, and then it pops back, and it's unpredictable. Anyway, it affects a lot of people. Okay. Are there specific populations that should be particularly mindful of their omega-3 intake, such as pregnant women or athletes?
Yes, for both of those. Athletes tend to have lower levels, as we've seen, and need more omega-3 to keep those levels up. And
why do you suppose they have lower levels, athletes?
Well,
is that just how the population is, or they're...
Well, no, I don't know. Short answer. My guess is I said that omega-3s are not really used for energy. But maybe these elite athletes, these folks who are really pushing exercise, maybe they are burning some omega-3, which would reduce levels. That could be. I mean, nobody's done the study to figure out why levels are lower in some of these high-end athletes, but it seemed to be that they are.
What do you think of some of these studies that show improvement in like TBI, brain injury and concussions, or shortened recovery time with omega-3? You like those studies?
Yeah, sure, I like them. Of course. It's really hard to do those studies in humans because you obviously can't give somebody a head. You can't just bonk somebody on the head. You have to kind of randomize a football team to fish oil or not, and then count the number of concussions over a season. There's so many things, so many factors that could play into that. Helmets, what level it hit. But when they do those studies in animals, which are much easier to do, you can put a rat to sleep, put them in a little device, and give him a concussion, and then wake him up and see how he does. In fish oil group, non-fish oil group, and they do better. So animal data is pretty convincing that there's a benefit to having high omega-3. That again, it's going to be very hard to prove it in humans. Mm-hmm. But we know the safety profile. If you always look at risk benefit, the risk is far less. The benefit is good. Yeah,
it's tough to do some of these studies the way we would really want to do them because they're just unethical.
Right.
But the study I'm talking about was actually involved the University of Utah. A couple of NCAA football teams and starters, guys that played a lot, and that, I think it was useful. Whether it was hugely significant or not, I don't know, but it certainly corroborated the animal studies, and I think it's a concern that parents ought to know about. We start these kids pretty darn young, don't we?
Absolutely right. Definitely, if I had kids in that world, I would definitely be sure they were on omega-3. It has a lot of other health benefits, even if it doesn't help this, but it should help the brain recover from a concussive injury.
Yeah. Okay. So the pregnant women.
Pregnant women. Yeah. I mean, that's one of the clearest stories now in the omega-3 world of the omega-3, taking omega-3 during pregnancy, particularly if you're low levels of omega-3 already. If you're a pregnant woman with a low level of omega-3, Giving omega-3 supplements has been shown to significantly reduce the risk for preterm birth. And that's obviously helpful for it actually just allows the baby to stay in the womb longer.
Babies do better when they're well-baked, right?
Right.
They do better, yeah.
That's right. And the omega-3s seem to help that happen. Plus, there are other benefits to mom and baby. There are studies that show, women that take omega-3 during pregnancy have kids that are cognitively healthier, and there's other studies that don't show an effect. So it's kind of a mixed bag. But they're never, worse off for having been exposed to higher omega-3 during pregnancy.
Yeah. Okay, great. How do omega-3s interact with other common supplements or medications? Are there any, I'm not aware of any real interactions that maybe your doctor ought to know if you're on Eliquis or a blood thinner, but...
No. And even though, it's not really been tested with Eliquis, but it's been tested in studies with other blood thinners, warfarin, and aspirin, those kinds of things. And the omega-3s don't increase risk for bleeding if you're taking with those.
Yeah, you always say it's about like taking an aspirin, right? Like a baby aspirin?
Yeah.
Okay. In terms of its effect on that. We kind of, I don't think we went back to platelets. Do you mind just talking about, is it about aggregation, or is it about making the red blood cell just more malleable, or maybe all of those things? What's its effect on platelets?
Platelets, of course, are the cells in the body, in the blood, that react when you get a cut.
To clot it off.
An injury, to clot it off, right? They're the first line of defense. And the omega-3s were the actual first hypothesis by which omega-3s were supposed to reduce risk for heart disease or heart attacks, which came from the studies in Eskimos in Greenland in the 1970s. The hypothesis there was that the omega-3s make the platelets less sticky, so you are less likely to develop a blood clot in your coronary arteries and have a heart attack. So
basically clotting where you don't want it.
Clotting where you don't want it, right? You do want clotting, but you don't want it all the time everywhere. So the omega-3s, and they do have that effect. They make the platelets less sticky, but they make them so there's a continuum. You don't want them to be so unsticky that they don't clot. That's not good. But they shift you kind of like as you said, like taking an aspirin. It thins the blood a little bit, and that's one of the benefits of the omega-3s.
Okay. Any potential side effects of taking omega-3s, and how can they be mitigated?
Yeah, if it's side effects, we mean things like burping up or fish taste. Refrigerating or freezing supplements doesn't do that. That won't block that. There's taking them with food helps. Some people, if you take them at bedtime, that's okay. Usually at bedtime, people still have food in their stomach from dinner, and they're not completely cleared. So taking at bedtime can help. Many people don't get a reflux, so they don't have to worry about it. I do, so I take mine with food, and I take it. And taking higher purity omega-3 products will reduce the risk of, or reduce that burp back.
Okay, yeah. So there's that. That's out there. That's a thing out there. If people say, yeah, well, if you're burping it up, it means it's rancid, and it's
maybe.
Yeah, maybe.
Yeah.
But I'd say if I can, I'll just tell you what two things that I've kind of settled on over the years as a pharmacist. When I dispense it, I will recommend not only do you take it with food, but you take your whole daily dose together at one time at the beginning of your meal, and then pile food on top of it. And I don't know if there's how much logic or how much truth there is to that, but it seems to work. If there's more food separating the omega-3 fish oil from your pyloric sphincter, you're probably going to do a little bit better. And then the other thing I tell them is don't gulp liquids with it and get air in your stomach.
Oh, that's a good point. Yeah, I never thought of that, but that makes sense. That makes a lot of sense.
I don't have any trials to prove it, but there you go.
Some things are just, you just learn them.
And it seems to work. So that's kind of what we do on the ground here in the ward. How can individuals on a strict vegetarian or vegan diet ensure that they get enough omega-3s? That's a challenge, and I've addressed it a couple of times, but why don't we hear it from you?
Yeah, and I'm sure it's the same thing you say. Take a vegetarian supplement. You can take a vegan or an algal omega-3 product, and there are more and more of them available nowadays. EPA and DHA that are produced from microalgae of particular strains, particular species are just designed to make EPA or DHA. And these are the microalgae that are in the ocean that are the original base of the food chain for omega-3s. And scientists have just discovered which ones they are, and they isolate them and they feed them with sugar in a big vat. And these bugs just make omega-3s. You can isolate it from the bugs, extract the lipids, put it in a capsule, and you've got a perfectly good omega-3 product that did not come from an animal. And the response should be the same in terms of milligram to milligram.
Right. Yeah. But practical aspect of it is they usually are a little bit more expensive. I think the process of extraction is probably a little bit more pricey.
I think demand will go up, and particularly as we want to, reduce our dependence on the ocean.
But you can get there with those products.
Absolutely.
And unlike other plant source, like you mentioned flaxseed, you mentioned
that's not going to do it. Chia seed.
Chia seeds, because that's alpha linolenic, and that. So there's omega-3s, DHA, EPA, and then the alpha linolenic, not alpha linoleic, but the linolenic is an omega-3, but not an efficient provider of omega-3s. Yeah.
No, I mean it's not a efficient provider of EPA and DHA.
You'd have to take an awful lot, wouldn't you?
Well, even then, it doesn't convert very well. Just made a slide of a study we did years ago comparing 6 grams a day of ALA, alpha linolenic, which is like 5 times the normal intake. It didn't change the omega-3 index at all.
Wow.
Didn't raise it at all.
6 grams.
Yeah, partly because you'll make a little more EPA, but you reduce the amount of DHA in your red cells doing that, and so the omega-3 index isn't changing.
Yeah, whereas 2 grams of EPA, DHA, huge difference there.
Okay. Same study, right.
Okay, so vegans and vegetarians, you can do it this way. There are products out there that provide it from this algae source. What are your thoughts on supplementing omega-3s through fish oil versus plant-based? We just talked about that. Comparison, they're fine. They'll compare to each other. Yep. Right. Okay.
Gram for gram omega-3, they're fine.
How important is the source of fish oil, and should consumers be concerned about contamination or sustainability? I know that's a big topic. The sustainability.
That's not my world.
But I know you have some frustrations around that, Bill.
Well, yeah. I mean, I sustainability is an issue. I'm sure it gets blown out of proportion. Because it somehow gets political.
It does.
And that's unfortunate. I think the future will eventually, if we can get over this kind of irrational fear of anything that's GMO, regardless of thinking about it, scientists in Australia, particularly, and in Canada, are doing genetic modification of certain seed oils, like soybean oil, like corn oil, like camellia seed oil. Certain plants, they can put the genes into them so that the plant makes EPA or DHA. And you can get it out of something with roots. You don't need, if that can be commercialized and brought up to scale, then you don't have to kill any fish to get the EPA and DHA. Using microalgae, using plants that you can grow on dirt, you can produce enough EPA and DHA to meet the needs. So that's, I think, coming, and I think will depend less and less and less on fish. it'll be an economics issue, prices and things like that. But people will spend more money for sustainable things.
Yeah, and I've heard you say many times before that there just aren't enough fish in the ocean. If everybody wanted to get on a supplement that they probably ought to be on, it isn't sustainable. So I guess people, and a lot of my followers also a little distrustful of government, and there's some fear that we don't fully know what happens when we mess with genes and genetically modify.
Yeah, understand. But you have to do the best you can. I mean, is it worth doing GMO to make a tomato stay ripe longer? What's the price of that? I mean, maybe that's bad. But if you're doing GMO to produce an oil that you extract from a plant, now the plant's gone, you just have the oil, and the fatty acid composition of the oil is very traditional. It's just got higher EPA and DHA, and you feed that to people. You're a long ways from DNA at that point. That's
true. Yeah, you are. I guess the concern would be more valid if you're consuming the plant.
Right.
What you're saying is you're consuming a product. It is what it is, and it's no different from any other DHA, EPA.
Right.
All right. Well, good point. Very good point. Okay. Somebody's asking about which brands of fish oil are most reliable and trustworthy. I know you probably don't want to go there.
I don't want to go there.
Yeah.
No.
I think it's best to kind of educate people on what they're looking for, and then let them pick a brand. I'm a little bit partial to not using plastics, so I always tell them, find one that's in a glass jar if you can.
Okay, fair enough.
How can consumers determine if a fish oil supplement is of high quality? What's the best way that you use to judge what you buy?
I think probably the
omega-3 index.
Well, right. I mean, ultimately, it's how do you respond to whatever it is? But when you're standing in the grocery store or the drugstore and looking at a bottle, how do you know? Typically, the higher the concentration of EPA and DHA per capsule, the more purified the product, the more high quality it is. It's also more expensive.
Uh-huh. Do you think that Totox scores and peroxidase scores and those kinds of things are helpful at all? Supposed to indicate the amount of oxidation that's taking place, right? Before it gets to you.
But I guess the implication is then that's show me the evidence that's harmful to a human. It's one thing to have a number that's based on a chemistry in a test tube.
Mm-hmm.
Show me that higher Totox product, it may taste worse. You may burp more. I don't know. Possible. But I haven't seen the data that says that is medically unhealthy and it's going to hurt you.
Okay.
I mean, your body's got a lot of defense systems up there. So,
But that high potency may not be there if it's more oxidized.
Potentially, yeah.
Yeah, okay. Yeah. Potentially. So, and then we haven't addressed here the difference here between EPA and DHA and what you feel is important in that mix, percentage-wise.
Yeah, a good question. Good question. A good question with not an easy answer. I kind of start off with, what's in nature? What's in our food? Well, EPA and DHA always come together in seafood. Okay, that's one thing. So maybe that's the way it's designed to be. Maybe that's good. Most of the vast majority of the evidence of benefits of omega-3 have been done with omega-3 EPA and DHA combined. Lately, they've been able to give pure EPA and pure DHA, and one big study gave pure EPA and had great findings. The Reduce It study, and so that made EPA look good, and that doesn't make DHA look bad, because they didn't do the study with DHA.
Mm-hmm.
We don't know. Nobody's done a big prospective randomized controlled trial with cardiovascular endpoints with DHA. Hasn't been done, so we can't say. I always tell people I'd like to see both of them in the product, and what ratio? A little more EPA than DHA or more DHA than EPA? I'm kind of agnostic on that. If it's, 60-40 one way or 40-60 the other way, that's fine. I don't worry a lot about that.
Okay. I think it's interesting if we go back to the VITAL trial that was done on Lavazza, the esterified estrogen,
Not estrogen.
hormones on the brain.
Gotcha.
Esterified ethyl ester. There we go. Yeah. What bothered me about that is why in the world did they just use a 1 gram per day dose?
I think it was practicality.
Really?
Well, and it's not irrational. I mean, the first big study to put omega-3s on the map was 1 gram of Lavazza. It was called Omicor at the time.
Mm-hmm.
The GISI Prevention study from 2000, 24 years ago now. But that one capsule in heart disease patients was very, very effective. And so a lot of other studies have been done, say, well, let's test that 1 gram, and some of them haven't worked. VITAL being one. But I know, and plus, if you're doing a study of 25,000 people all across the country and doing it by mail, and you want people to be compliant, they said 1 capsule. So it's 850 milligrams of EPA DHA. Okay, that's maybe 5 times, 6 times the average intake. So that's not irrelevant.
Because it's all relative.
It's all relative. I mean, these trials have logistic challenges. They don't they can't just make everything perfect. They've got to take into account reality.
Yeah. Okay. So let's, what? Why don't we talk about the omega-3 index? This is, we've referenced it several times now.
Yeah.
Tell us, I think this is amazing to me, because, boy, what anybody looks for that's serious about improving their health or getting the full benefit of something is, I got to be able to measure something to tell me that it's working. And because especially these things we're asking people to accept on faith that really over 10 years, this is going to do you much better. People struggle a little bit with that. So I think this is awesome. This is amazing. And so tell us about that and why you settled on the red blood cell membrane as a test.
So, the omega-3 index is a blood test, and it does report the EPA, and
there we go.
The box. Yeah, there's the box. And it can be done on a dried blood spot, as you know.
Which is nice because that means people can just take a drop of blood, put it on the paper, and mail it in.
Right.
That's a big deal, that convenience.
It's very convenient. And so that's doable. We analyze that dried blood spot, or we analyze regular blood samples too, that you can do it on both. And we report the amount of EPA and DHA in the red blood cells, which is red cells are fundamentally all a membrane. All the fatty acids are in the membrane of the red cell. So we're looking at the red cell EPA, DHA as a percent of the total fatty acids in the membrane. So there's membrane's a fixed size. You have a fixed number of fatty acids in there. And what percent of them are EPA and DHA? And so we've come up with 8% or above is kind of the sweet spot. That seems to be where the most health benefits arise. And that's the most uncommon level in the United States for sure.
Yeah.
Only about 5, maybe 8% of people have an omega-3 index over 8%. Most people are, on average in the U.S., around 5.5.
Wow.
If you're a vegan, like 3.5. You just don't eat it, you don't get it. Problem. Yeah. So that's the test. Red blood cell membranes. Why that instead of plasma or serum? The red cell is number one. It's a cell, and all the omega-3s do their work in cell membranes, so it's more representative of the tissues. It's less likely to fluctuate day to day. Depending on how much omega-3 you may have eaten yesterday, your plasma levels will do this, but your red blood cell levels are very straight. It's very much like hemoglobin A1C for diabetics or people who are interested in their blood glucose control. Instead of measuring a plasma glucose level, doctors measure the hemoglobin A1C because it's measured in a red cell, it's expressed as a percent, and it's a more stable, it buffers the variability that happens day to day. And so that's why we like the red cell.
Awesome.
It makes sense.
Yeah, it does. And, in the medical world, change is like an ocean liner, trying to turn an ocean liner. It takes...
Tell me about it.
It's been what, 20
years.
20 years since you developed that test. Although it's being used now more and recognized.
It is. Part of the trouble, and there's been a huge increase in the amount of clinical laboratories, regular medical laboratories that are measuring omega-3 levels. They just do it different ways. Some of them will use just plasma levels. They'll give you your plasma, and that's not nothing. I'm happy to see anybody measuring omega-3 levels, and as long as you keep going to the same lab and you get the same report, it's going to be helpful. Because if you're low in omega-3 according to the plasma test, and your doctor says take more omega-3, then it's a win. I'm happy. Some people we use red cells. Other people use whole blood omega-3. They're all different numbers. But I think it's getting out into the wider medical world that omega-3 levels mean something. They predict risk for disease better than cholesterol. That's for sure. When you're talking about heart disease,
and that's a critical point to me. You've got a risk factor here that's emerged that you're able to quantify, and why wouldn't somebody want to know
and modify
what that is? Yeah, and modify. Yeah, it's responsive. You can judge the effectiveness of your intervention.
Right, exactly.
That's amazing.
We love this test. We glad to see other people use it. So we're just keep selling omega-3 index tests. That's what we're doing.
Yep. Well, I recommend it.
Good.
The other thing that I really like about it too is that there's a little bit of a variation in response, is there not? And supplemented EPA, DHA. You don't know
person to person.
Mm-hmm. Person to person.
Oh yeah. Give them the same dose. Some guy goes up from 4% to 5. Some guy goes up 4% to 7. Or they don't change at all. I mean, it's crazy. We don't really understand all the factors that play into the response to the given dose of omega-3.
So this can help you set your dose, maybe change your brand, whatever it is that needs to be changed.
Right.
If it's not achieving those, and then so tell me the significance in terms of. I know you've done some studies on that of raising it, say, from 4 to an 8. Right.
So and I think that's the beauty of the omega-3 index. We've done so much research linking, say, a 8% omega-3 index with healthier outcomes, whether it's cardiovascular outcomes, total mortality, whether it's death from cancer, whether it's risk for asthma, things like this. Those are clinical outcomes. And we've seen time and again, even dementia. People who have the highest omega-3 levels around 8% and above have healthier outcomes. They live longer. And so, I mean, like you said, you can't feel a low omega-3. Like you can't feel a high cholesterol. Right? It's something you only know about it if you test. And if you have confidence that enough research has been done to say that if you're in that same zone that's been shown in studies to be protective, like 8% or above, then you're doing yourself some good. That's the only way you know. I mean, it's not like you've got a headache and the aspirin takes it away, so the aspirin works. But with omega-3, with almost every nutrient, you can't sense a deficiency.
Mm-hmm. Yep. So it's right there in front of you, objective data on paper. You're going to hate me for this, Bill, but it illustrates so dramatically the difference in an omega-3 index score. in response to a question, I think it was Rhonda Patrick asked you this, but compare someone with a low omega 1 or omega 3 index to a smoker.
Oh, that.
That. So I asked you, okay? You didn't volunteer it.
No, that's fine. And this was an interesting analysis we did in one cohort called the Framingham study. And we had measured the omega-3 index in it's around 2,500 people. And they were on average around 66 years old at the time. And it's important. So that's the context. And we had a range of omega-3 index from the lowest 20% to the highest 20%. And that roughly goes from 4% to 8%. That's the general span. I mean, because in Framingham, in this Boston suburb, people aren't taking fish oil much. They certainly weren't 20 years ago. So we're looking at variations in omega-3 level that are pretty much driven because of diet. So that's the context. We followed these people up for who's died over the, say, ensuing 15 years after the blood test was drawn. And X number of people died. We found the people the highest omega-3 level were least likely to die over that time. So that's prolongs life. We asked the question, okay, let's say, how about smokers? Are smokers more or less likely to die over that 15-year or 10-year window of follow-up? It was about a 10-year window. And we found, not surprisingly, people who were smoking, who reported smoking at age 66. Okay. Still, about half of them, in the next 10 years, about half of them were dead. Okay. If you were not a smoker, maybe only 20% of people were dead. Okay. So smoking's a risk factor. Okay. No surprise. We asked the same question about omega-3, and it's kind of the same thing. If you had the high omega-3, you were 20%, only 20% died. And if you have a low omega-3, maybe 30 or 40% died. If you take the people who smoked and had a high omega-3, their risk for death was virtually the same as people who didn't smoke and had a low omega-3. So smoking and omega-3 were kind of in the same level of risk. Being a smoker is kind of like having a low omega-3. Being a non-smoker is kind of like having a high omega-3. All else being equal. Of course, all else is never equal, but in principle. So what we were trying to do with that analysis was trying to give people some perspective on, well, smoking's bad. High cholesterol's bad. Well, let's compare having a low omega-3 to having a high cholesterol. Let's compare having a low omega-3 to being a smoker. How does that? And they're not identical risk factors, but they're pretty similar.
Oh, that illustrates it dramatically in terms of something people know and understand.
Yeah.
The difference between when you say low and high, you said 4 and 8, right?
Roughly.
Yeah.
It's just whatever happens to be the spread in that population, which is we couldn't make people be 8, 9, 10%. I would love to have had people that really had a high omega-3. But when we just take a group of 2,500 people and we measure the omega-3 index, and then we split them into what's called quintiles. 20%, lowest 20%, the next 20%, the next 20%, up to the highest 20%. And the highest 20% is around 8% on average.
Okay. That's amazing. I love it. So there you have it. That's a test you can do. This is not really offered kind of at your usual lab, like around here it's LabCorp and Quest, and they don't seem to have it available. So
they don't do it, right?
Yeah. So folks have to buy this. Well, there are different places to buy it. You guys sell them directly, and there are other resellers, I know.
Is it?
But because it's a simple mail-in process.
Yeah. We love to have partners.
Easily done. Yeah. So that's something that I think is hugely valuable, and that's amazing. It pioneered that whole thing, and I think it's changing the way things are measured, and therefore, I mean, what gets measured gets done, gets responded to.
Right. You can't manage what you don't measure.
Yeah, exactly. Okay, let's go through a couple more questions here. Can we talk briefly about brain health? What were the impacts of omega-3s on brain health?
Yeah, that's a much younger field, so to speak, compared to cardiovascular, which has been known for like 40 years. Brain health, we start with understanding that the brain contains a lot of DHA. And a lot means it and arachidonic acid are the most common polyunsaturated fatty acids in the brain. The brain is the most fatty organ other than adipose tissue in the body. It's got more fat in it. There's lots and lots of membranes, of course, neural membranes. All those membranes are made up of fatty acids. And so there's a lot of fatty acids in the brain. And DHA is really prominent. EPA is very low. There's very little EPA in the brain. So just because it's there, it presumes there's some reason for it. So that's sort of the basic logic of looking at the brain and omega-3. People have and have looked at omega-3 in brain development. So in the pregnancy, early childhood, people that we know that DHA accumulates in the brain up to 2 years from conception to about 2 years of age. You see increasing amounts of DHA in the brain, and it's there for a purpose. So we're trying to figure out what the purpose is. In terms of what most of us care about these days is dementia, Alzheimer's disease. And we have shown in a couple of cohorts, the people that have the highest DHA levels, if you follow them over time, they're the least likely to develop Alzheimer's disease. There have been studies done where they give people omega-3, randomized trial instead of an observational study like we're doing. And they're mixed bags. One of the most compelling things I've seen is that when they study B vitamin supplementation and omega-3, they find that the people who are replete, who have a good B vitamin status as measured by having a low homocysteine level. So people with a low homocysteine level respond with increasing to omega-3 with increasing cognitive performance.
Oh, wow.
But if your homocysteine's high, meaning you're deficient in B vitamins, then the omega-3s don't work. And it goes the other way too. If your omega-3 levels are really low, the B vitamins don't help. But if your omega-3 levels are high, then you see increasing benefit with more and more B vitamins. So there's a synergy between B vitamin status and omega-3 and brain health.
I didn't know that.
Yeah, I mean it's not well known, but it's out there. Published papers on that. So obviously a good supplement would be a combination of B vitamins and omega-3. That's pretty obvious. And
did you measure that those DHA levels were measured in the blood, the circulating blood, right? You didn't measure it in brain tissue. Okay, all right.
Can't do that.
Yep, that'd be hard.
I mean, when people have looked at Alzheimer's brains and non-Alzheimer's, and same age but non-Alzheimer's, DHA levels are lower in the brain of people who have Alzheimer's disease. That fits. We know also that when they do brain imaging, and they can look at the size of like the hippocampus, which is really central in memory. The higher the omega-3 level in the blood, the larger the volume of the hippocampus. So it's that memory center is not shrinking as much. It always shrinks with age, but the higher the omega-3 level, the less shrinkage you get.
Wow. And are there good studies that quantify that risk reduction?
Yes, yeah. In one of our studies in Framingham, we saw that people who had the highest quintile of omega-3 levels were 50% less likely to become develop Alzheimer's disease or dementia.
Wow.
And that's been confirmed in other studies. So
that's huge.
Yeah, it's huge. It's important. And so we like to get that message out too.
Okay. Somebody asked if there are credible claims that omega-3s cause cancer,
No.
as some sources suggest. No credible evidence of that.
There was a big fluff up about 10 or 12 years ago that prostate cancer was increased, and that's been debunked since then.
Okay. All right. Good. Can fish oil supplements be beneficial for individuals with inflammatory conditions like arthritis, or maybe some other, if I can extend this, other autoimmune diseases?
Yeah. Actually, that's one of the good outcomes of the VITAL study. They published a paper looking at new onset autoimmune disease in the people who took part in the 5 years of supplementation with one capsule of Lodeza, and they showed a statistically significant reduction in new onset. What am I trying to say?
Autoimmune something.
Autoimmune, thank you. Yeah.
Okay.
Autoimmune diseases within the people that got the omega-3s.
Do you recall what specifically was it? Any like lupus or arthritis, or do you know?
I think it was because there's so many different types of autoimmune. I think they just pooled them into one so they have enough numbers to do the statistics.
Yeah. All right. Okay. And then we've kind of already answered, can omega-3 supplements improve cognitive function in aging adults?
We think so, right? I would bet on it. Can we prove it? There are some studies that support it, some studies that don't, but none of them show you actually get worse by taking omega-3, so take it.
Okay, yep. The immune system, how do omega-3 support overall immune function? Kind of a modulatory?
Yeah. The immune system is so freaking complex that it's hard to say. We've looked lately at a ratio of what's called the neutrophil to lymphocyte ratio. And neutrophils are more in the inflammation side, and lymphocytes are more in the immune system side. And we find that the higher the omega-3 levels, the more favorable that ratio is. There's less inflammation, more protection, more support for the immune system. But I can't get much more detail. I don't know that much more, that much about the details of the immune system.
Okay. How about eye health?
Well, yeah. The eye is about, at least the back of the retina is one of the richest DHA tissues in the body.
Really?
Which attracted attention early on as to why is that. And so we knew babies' visual acuity, if they had low omega-3 levels in their retina, visual acuity wasn't as good. They kind of grow out of that in time. So that was from the 80s. We figured that out. More recently, the interest has been dry eye, and because so much LASIK and other surgeries are done, and dry eye is a problem, and omega-3's treatment has been shown to reduce dry eye symptoms. Some studies, I know there's studies where it didn't work either. But again, if the risk is next to zero, then any benefit puts a good ratio on the risk-benefit ratio. And so, yeah.
For sure. It's one of the great things about omega-3s.
Yeah.
Just not much of a downside, is there?
Right.
Is there any evidence of reducing some of the degenerative processes like macular degeneration that come with age?
Uh-huh. Yeah. There's some evidence that higher omega-3s, once again, I have to say it, some studies, omega-3 levels don't predict who develops macular degeneration, who doesn't. Other studies do. Same for glaucoma. The high pressure in the eye, there's higher omega-3 has been associated with lower risk for glaucoma. Whether nobody's looked at cataracts yet, I'd be curious to see if there's a relationship between omega-3s and developing cataracts. but that's another common eye problem, of course.
Okay, and then final question from the followers: can omega-3s impact weight management or metabolic health? So maybe kind of two different questions.
Not really weight. I mean, in all the studies that have been done given omega-3 supplements, people haven't lost weight. Okay. So it's the studies aren't designed to cause people to lose weight, but you would think over all these years we would have seen a signal for lower weight loss. So it's not for weight loss. We've seen, and there's been some good randomized trials to show increased omega-3 will help reduce risk for diabetes. So
well, that's something.
Good.
Yeah.
Not by virtue of changing body weight though.
Uh-huh.
Yeah.
Okay. All right. What if you were to look at the last 40 years? I mean, we have the great opportunity here of having a guy who's been around kind of for the whole show. Back in the 70s, he started. What would you say were the most seminal studies or research that has had the most meaning and given omega-3s the most momentum?
Oh, well, yeah, easy. It started with the observations of two Danish scientists called Dyerberg and Bang in Greenland Eskimos in the 70s, where that was what revealed the potential heart benefits of omega-3, and that started the whole revolution. The big turning point studies, probably 1999, 2000, the GISI Prevention study, where they gave people with post-MI, post-heart attack patients 1 capsule of omega-3, Omicor or Lovesa, and showed a pretty significant reduction in sudden death, total mortality, and that lit the field on fire. First time a randomized trial with an omega-3 supplement actually showed good benefit. So that was 2000. I think the demonstration that the omega-3s can reduce risk for preterm birth, which is fairly new, that's about 2 or 3 years old. That's been an important thing for maternal health and obviously babies. And I think our 2004 paper 20 years ago on creating kind of inventing the omega-3 index, I think has been very helpful, because it allows people to follow a marker and to be able to compare against studies. So that's, and it tells us that omega-3s are a risk factor. They're not just a biomarker of fish intake. They actually mean something.
Oh, yeah. Okay. We talked just for a second about the strength trial. So that was a study that used the free fatty acids, right, carboxylic acids. So they're not esterified, just kind of floating freely.
Right.
Stopped early for futility.
Right.
Now that there's been 4 or 5 years of maybe retrospect on it, what are your thoughts on that trial? Was it useful? Was it futile? Does it have to do with the form?
I think it might have. I don't know. And in fact, I just today I was speaking with one of the principal designers of that study, Dr. Michael Davidson, who was really still shocked, like I am, that study didn't work. I think one of the problems with that study may have been the fact that the placebo was not also in carboxylic acid form, not as a free fatty acid.
Was it
placebo was
olive oil or something?
Yeah, olive or corn oil.
Uh-huh. Oh, corn oil. Okay.
And that's a triglyceride. That's very natural oil. The free fatty acid form, the carboxylic acid form, which only the omega-3s had, the placebo didn't have that. It can be irritating to the GI tract, which is why they had to enterically coat it. Now, the placebo was not enterically coated. Should have been. They want to compare head to head.
Mm-hmm.
So I think it's more about the formulation of the omega-3s. That was a problem. There may have been some kind of a global inflammatory response to these free fatty acids regardless of the fact they were in omega-3 form, I mean, this is just my conjecture, that the benefits of omega-3 that we normally expect to see were reversed by giving a free fatty acid form. And we couldn't see that because the placebo group didn't get a free fatty acid.
Hey.
So that's my guess. I don't know that we'll ever know, but it was a shock to everybody that study was not positive.
A shock because it didn't in vitro, so in a lab, didn't it show that it should work? And then maybe this is a good example of when you take something and now put it in a human body, other things, like for instance, it was anti-inflammatory in the in vitro studies, if I recall. I mean, what in the world got Epanova on the market in the first place if it didn't have some effectiveness?
Well, it got on the market because they showed that it lowered triglycerides.
Oh, okay.
That's how it got on the market.
And this was a new endpoint.
Yeah, then the strength trial was looking for a new endpoint, a new indication, not for just triglyceride lowering. And it showed that it did that. And well, that's fine, but that's not the mechanism by which omega-3s reduce risk for heart disease.
Okay.
So, I mean, just 3.5 grams a day of EPA DHA, which is a really good dose. And so, the fact that it didn't work, it was I think, surprise to everybody.
Well, okay. So it kind of begs a question. So there are these different forms. There's the triglyceride form. There's the ethyl ester, which is Leveza that's available by prescription. And then there's a phospholipid form. And then these free fatty acids. You feel like maybe with the exception of the free fatty acids, it kind of doesn't matter on the form of the others, or you just kind of zero it in on what works for you and raises your index?
Yes. I mean, at one level, we do know that the the ethyl esters are much better absorbed if you take them with food, which is why you recommend people take them on an empty stomach, and they don't raise omega-3 levels very well at all, the ethyl esters. But most people are fed most of the time.
Yeah, yeah.
There's something in their stomach. Triglyceride form is probably the best, or at least as the phospholipid form is good. It's a little more expensive, and it doesn't really, gram per gram, doesn't really raise the omega-3 index that much more than a triglyceride does. It does better than the ethyl ester, but
And the ethyl ester, okay, so you can give more and maybe get the same effect on it. As long as you take it with food, yeah. But
right.
So the triglyceride is generally what you'll see in the over-the-counter market, is my understanding.
Right.
Yeah.
Right.
Okay. All right. Well, now, what is it that, and we're just wrapping up here, what is it that most excites you in the field and the future on the horizon?
Well, what most excites me is it's my dream for the last 20 years is that this will become as common, the omega-3 index test, or I'm okay with any omega-3 test, but that it become as common as a cholesterol test and done every year and part of a standard physical, and people would take action on that test. If it's too low, whatever method you're using, that people will be told to take omega-3 because it's important. That would be my dream. That would happen. As far as supply of omega-3, I don't think we're going to keep getting it from fish. I think the krill is a good source. It's expensive to get it out of krill. I think the microalgae approach, which really is unlimited in potential, it's just a matter of how many factories you want to make. It is a really good possibility for generating omega-3s without taking any fish, which I think is a great way to go. That or the land-based GMO crops that will have omega-3 in them. But I think the omega-3s have shown that they're beneficial just across so many systems or health conditions. I just look forward to the fact that hopefully we're making enough noise to get the medical community and the rest of the population to realize the omega-3s are important, and they should be part of everybody's diet, whether it's fish, whether it's supplements. They need to be raising their omega-3 index, and get it to 8% if you can.
It sounds like it surrounds the idea of getting this out. More people.
It's getting it out, right? We've got tons of research. How do you get it out to people and get it in practice? It's things like what you're doing right here that will do it, and I appreciate that.
Yeah, well, I hope we can. It seems like it's that's tough, but people will grab onto what they understand and realize is actually going to make a change, is going to make a difference for them, and sometimes that's hard with these things that happen over time.
Oh, I know. Prevention is always harder than treatment.
Yeah. Well, sir, your body of work is a national treasure. I don't know how else to say it.
That's kind.
And well, it's the truth. And I would thank you here not only for giving us your time today, but just for your entire career. If I can say that for my hundreds of thousands of followers, and I'm sure others share it.
Well, I got on the bike got on the horse at the right time and just kept riding it. I'm not that special. Just happened to be there at the right time.
Well, it sounds like a fun journey, and you are special. I'll take issue with you on that.
Thank you. Thank you, Wayne.
So over the course of your career, what's I think I know the answer to this, is what's brought you the most professional fulfillment? And get as specific as you want there, but I'm just curious, do you think it's the same thing as what you'll be remembered for when you're gone, which I hope is a long time for now?
Well, I appreciate that. Yeah, you're right. I think it's the omega-3 index. If that's my contribution to the field, then I'm happy with that.
And that's probably giving you a lot of satisfaction, I'm sure. My gosh.
It does. Right.
It's an amazing thing.
Something that's, some people do research all their lives and never produce anything that's practical.
Well, yeah. Thank you.
You're welcome. Thanks for having me.
It's been my honor and my pleasure.
Okay. Thank you, Lane.
Bye-bye.
Take care.